Today na the 18th day of May 2022. One calendar table, waiting the president been talk na parliament concerning healthcare na salon. Yesterday, we been there, they try for clarify one or two things about the bridge. But there be a question where EU been asked, now we try for reiterate. I'm gonna follow today. I meet people and they talk about me. And they talk about Tiara Network. I just want to do small disclaimer before we start today's own program. Because this one again, we are going to ask question. Una, we sit down, they talk, they discuss. Say tripule. Na APC na ingia money. Na make tripule can sit down na they talk about bridge. Or maybe today, the question they ask the president say, do ya go mad? That ultra modern diagnostic center where you been done promise me. How far? Sometimes you can't take them back say, na money they don't go give, na make they can't talk them. Yesterday, I be talk small thing here. He who feels it, knows it. Beaucoup of we. Light, water, good, healthcare, nine job, social safety net, nine make we don't sell, we sold them. To then country where we dey. So man, if you list just the basic, then go make it say you need to go salon. Right now, lights no dey. As we speak, they don't begin to line for fuel back in a salon. Or not for talk about them. No, because who say you there? You just they pull up na gas station, you pull your card, you buy. But who say we there na salon? We get for two line. If you not connected, if you not go get fuel. We need them na santem, for lights, for do we work them, even for drive around. When net come, we need them for light generator for make we able for live a comfortable life. But still yet, you have people that will say, not for talk about them. Na politics. We not deserve them. We not for talk about them. Why? But you want for choose what you want, we for talk about. I'm sorry to disappoint you, because today is going to be another one. The president, we don't tell we say, we go get an ultra-modern diagnostic center na salon with the money where ACC they collect. What's happen? Now 4 years on. For go turn the teacher for the ultra-modern, we not see. Maybe they not get the land yet. We not see. But now, we see a private investor don't come say, in they can open an ultra-modern. No, in they can open diagnostic center, not ultra-modern, you know. Yeah. The new direction, you know, na the ultra-modern. But the private investor in you, in just they can open a diagnostic center. So, we need to forget Amboku. Okay. I want to start first. I want to start from this one here. I want to take we mind go back. For una way. On the 28th day of May 2020. The 28th day of May 2020, the president began a parliament back on the state opening of the third session of the 5th parliament. This was what they carried for you, so now be May 28, 2020, waiting the president been talk under health care na parliament. He say, Mr. Speaker and honorable members, me at glady for report to una for say this year, then na 2020 you know to this one. This year is saying na the third consecutive successful hear them. We in government don't increase healthcare budget allocation. He said when we start 2018, now be 7%. 2019, he said he increase them to 10.5%. Then he said 2020, increase and go to 11%. He said then don't hire 2,500 healthcare workers. And in ready for inside 2020 no more for hire 2,000 more. And then one and the way in go higher is anyone focus per midwives, pharmacists, pharmacy technician, epidemiologist, clinical and surgical community health officers them. Now then in be one focus per. That was 2020. He said, in don't get to yourself where in don't institute and something we go continue for bring education for nursing professionals them. He said they don't review the compensation for the healthcare workers them across the board. Now yeah, I want make you focus per more. This was 2020. Mr. Speaker, in line with my own commitment, in line with my own commitment for establish an ultra modern diagnostic facility in Salone, me at glady for announce to this house, that at the House of Parliament, for say cabinet don't already approve $19.8 million for the construction of a national diagnostic and radiotherapy cancer treatment center with modern facilities. You hear? Let's go back and again. 2020. The president say he had glady for inform parliament say cabinet don't already approve $19.8 million for the construction of a national diagnostic and radiotherapy center. Cancer treatment center with modern facilities. Now, they say na ultra modern. This will substantially reduce cost of the one that they travel go overseas for medical attention, and it go broaden the access to more people within a salon. Fambulem, maybe 2020. Now, the president be announced this in parliament. Law left the second part because about COVID. Law left, but now yeah, maybe one focus pa. Because now yeah, we dey deal with today. We don't hear you know so. $19.8 million cabinet already approved. Already approved. $19.8 million. 2020. Alright. But they are fumble them. And waiting the president been talk na Parliament 2020. I want to wait he talk this year. Oh yeah. This year na Parliament, this now waiting the president say about health care. He said, Mr. Speaker, honorable members, he said, I get strong believe in say, every person na Sierra Leone, we other person there access to quality and affordable health care. We dey hear the president dey talk. He say every person na salon, the country other person dey access to quality and affordable health care service. And the person not for suffer financially for access that kind of service day. Now in talker. He say, and this na the responsibility where me young government it take very, very, very serious. If you dey watch the speech where the president begin on the state opening, na paragraph 30, so now they go 31. Something you want for read along with me. He say, in line with we own universal health coverage, the goal they don't put, we don't develop a new national health sector strategic plan. National health sector strategic plan and a health financing service we go on from 2021 to 2025. He said this one don't increase now the budgetary allocation for health and sanitation to 12%. 2020, he said it don't go 11%. So now yeah, I read them for you just now. So now yeah, now it try for tell we say it don't pull them from that 11%, it counter now to 12%. He said this way, it go realign the leadership and the structure of the health sector in order for make them go waiting, maximize efficiency. He say one like one no say, they don't restructure and right now then they work towards making Sierra Leone social health insurance scheme for make it go work na the country. He said, in the way they look, they don't promote social dialogue with stakeholders, them whether inside the healthcare sector. They don't provide health insurance for all healthcare workers. Look the word all healthcare workers. They don't regularize and strengthen the national drug distribution system. They don't expand free healthcare service to school going picking them, the old people them, and people them with disability. 32. He say when don't look around the world, technology, then they use them for drive healthcare service delivery. Then they use waiting technology. He said then they also use them for improve healthcare outcome and for empower patients them. He says so Salon no go left behind in this kind of regard. Which regard did they talk about? For use technology, for drive healthcare service delivery, and for improve the healthcare outcome and for empower the patients them. He said no go left behind. He said in that regard, in young government actively don't take advantage of technology and innovation for deliver inclusive. So one person no more. He said inclusive health service and health information with the support of the People's Republic of China. My government don't launch the Health on Wheels. I think I yok them be go launch that one. I don't know if you be watch them. Health on Wheels initiative. We go provide full spectrum of health service to undeserved communities. Governments don't strengthen the health management and information system. Data from which he say they go able use for support inform strategic decision making them. And not only no more, they go even use them for program development and also case evaluation and management. He say they don't also adopt a hub where they go do for restructure healthcare service delivery so that every healthcare facility within a 5-mile radius of Sierra Leone go benefit. Me government also don't strengthen disease surveillance and emergency system. I saw the president say. Until I will be check the 3 number them for the anthrax disease, the anthrax outbreak. Now check not so. Then work, they all answer. We've been talk to them. But anyway, the president say he don't strengthen now and then an emergency system. The surveillance directorate, they don't bring and come inside NACOVAC throughout the COVID-19 pandemic. He say right now an effective network of ambulance them, then they crisscross the country, then they work a better one across all the districts them na the country. Number 33, now there they go. We not just don't construct healthcare facilities there across the country. Hey, whoa. We not just construct healthcare facilities then at the country no more. What we don't construct them down? We are equipping them with diagnostic laboratory. President say when they don't build the healthcare facilities then done, then what they don't already do. Then they also get diagnostic laboratories. Then they left and they no more. Then get enough hospital bed them. Not so they no more. They also get other hospital equipment them. Now them facilities then they. So for the one the way they talk, we don't secure oxygen generator plants. We get an abo, we get an akenema. In case you don't know. In addition, my government, it don't allocate over 75 billion leons for refurbish, for improve. Also say refurbish and improvements not go take place. We dey rebuild healthcare infrastructure across the country. For the first time in 15 years, Makeni Government Hospital, Maboka Government Hospital, Potloko Government Hospital, Kabbalah Government Hospital, and other regional hospital them na the country will be, not of us say dendomo, will be renovated. It's a promise. And made fine one for provide critical health service. That's a promise. I will be you know say don't do them. 34. It says several PHUs when a public hospital units them have been constructed and they don't open them to the public. It say not so they no more, but the partners them who then they work with. They don't build number of healthcare facilities them across the country. The private sector and the non-governmental organization themselves don't invest in the healthcare sector na the country. He say the intervention that na the private or the non-governmental, he say the intervention don't it don't already or ego. I hope you don't understand the Creole. The intervention of the non-governmental or the private people inside the health sector, one, don't already increase bed capacity and provide advanced diagnostic service, or ego increase bed capacity, and provide advanced diagnostic services. Hope you understand. 35. With the expansion and the way manner how they upgrade the healthcare infrastructure na the country, we don't train and hire beaucoup nurse. This trip, the president not give a number. He just tell we say beaucoup. Train and hire beaucoup nurse them. Not to nurse no more, but they add doctor then they. Not to doctors they no more, but they add midwives then they. Not to midwives no more, they add pharmacists then they. Not to pharmacists no more, they add laboratory technicians then they. Remember, that what I read to you for 2020. Where it tell we say 3,000 more then go higher, and these were the areas now be say then go focus on. And also community healthcare workers than ever before. And the president they talk. What's in they don't do now? They not be ever doing before it. Let's continue. Now you're back. He talk about how they also don't review the compensation package for all classes of the healthcare service staff them. 2020, he said they don't review. 2022, they don't review. They don't make the changes. Or now for just the review no more. Or when they review now with change. Let's continue. 36. He say in ask him well we can watch and see say per all waiting they don't spend per healthcare na the country. Some areas then they can better, some areas then they not better it. He say but maternal and child mortality rates it don't reduce. It don't cut down na the country. He say also they don't reduce malaria related die. Over 47%. It don't reduce down na the country. Also, the disease, for them common illness than at the country, they don't reduce them. Then the one them we can go for life-saving treatment them for sick them like HIV, then one then they don't double. 37, he say in at glady. For tell we say COVID-19 vaccination rate don't go up than the average for African countries there. Whoa. Let's read that part stay back. The president say, in please for inform we say COVID-19 vaccination rates now na salon they up than the average self na other African country them. Alright. Well, I thank you. We always go take the vaccine as alone. But you want to tell thank you to the workers them, the healthcare personnel them, and also the citizens. We don't volunteer themselves for make them go take this life-saving vaccine. He say na hope for say the one they wanna go take the vaccine yet, then go make themselves available. For make them go access and take the vaccine and join the world for faith against COVID-19. 38. We partners them, including the Global Fund, the World Bank, FCDO, USAID, significantly they don't increase money where then they give to the health sector na the country. And the president talk am. He say Global Fund, World Bank, FCDO, USAID, they don't increase the money where then they give to the health sector na the country. He said to hundreds of millions of dollars. We like figures, Mr. President. You will finally give me the figures. Because now we say hundreds of millions of dollars. Me, I go one take and say now like $999 million. Now so me go one take. But anyway, now hundreds of millions of dollars due to the confidence where they get and the management where they handle the funds them, and the focus and clarity where then they use the strategy for achieve universal health coverage goals for all man na the country. 39. Where ACAID in look ahead, in government focus on strengthening primary healthcare service, disease diagnostics, and also for establish pharmaceutical production na the country. A ministry go bring to the house measures and legislation for achieve the outcome here. Fambulem, I did the president tapo by healthcare. He not talking nothing but diagnostic center. So I ask again, wetin happen to the ultra modern diagnostic center where the president been promised we? Because I just read for you 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 paragraphs. How it don't deal with healthcare? Nothing. Zip. Zot. But the ultra modern diagnostic center. But 2020, if you don't can tell we, for say cabinet don't already approve $19.8 million for the construction of a national diagnostic and radiotherapy center, cancer treatment center with modern facilities. 2022, no more updates. Then we not see them turn sword. We not see them the bill. We not see them go show we site say na them get for Cambilam. We don't collect already 23 billion leons. 23 billion leons now we don't collect already through ACC, because now then the ACC commissioner can't tell we Francis Ben Kaifala. Now then they can tell we say 23 billion per them one they will take we money by the past administration. Now then they don't get. And from the onset they say they go build this ultra modern diagnostic center so that we go see and say the money where them be collect. And then take build this. 2020 cabinet be don't approve. 2 years. What happened? Because for now, there is a private investor in Sierra Leone to build a general purpose diagnostic center. This one, where the president him be tell we, na ultra modern diagnostic center. But the one where the investor income for can bill na general purpose. So I want to do this thing. We can listen from the investor. If now I make the president not talk about the diagnostic center again, now I make, because now don't get possible they can do, but a private investor, they will ask question. People invest. They invest so. You know, when sometimes you and person they go back and forth on the person they try for play like say you fool. But when they try for sure and say, my dear, pass if I want to play along with you, but I can show you like this. Like this, look at. I know. But Gekko can say the ultra modern facility then go be like after Lungi Bridge. Alright. Fambul them. Me, I don't get problem with the investor where they can build in diagnostic center and a salon. No. But the president we don't tell we say they don't have cabinet to approve. 2 years. Fep. Or they go say na COVID. On the one na Ukraine. Who's one? But we go talk in a parliament now. You know talk nothing but why? Is it because of this private investor? Or they don't lend down 23 billion for us? They don't go buy treasury bearer bond. The money never work small money. Fambulem, through the democracy. On allow listen this.
Oversee medical trip. Now one area where saloon people don't they spend plenty couple over the past year them. We make government be making part of their agenda. Forget standard diagnostic and treatment center. We go tap people for travel overseas for medical treatment, and government we don't start some components of this the agenda. We make them be call on private-public partnership for supports. Dr. Sheikh Tijansi, now Senegalese investor and medical expert with over 10 years experience in the field of medical investment and over 20 years experience as medical biologist. And in the person we don't show interest for invest in the medical diagnostic center where government get plan for bill.
And Ayon, Musa mistake. Musa mistake we say we government get plan for bill. No. Now, two different ones that we talk about now. At the end of the day, you go can hear the Minister of Health and Sanitation, Dr. Austin Demby, where he go tell you about your government plan. But this one right now, now the private investor from Senegal, now they talk about yeah.
And we don't can engage with different authorities them na salon for see how they go able implement this program, but how it been taleg.
Of course, since we met the last time, we met with different officials.
Okay. Now the Senegalese Sheikh investor now in the talk soon. If he don't go salon before, he say he don't go back and he don't talk to officials then. You know, so you get for lobby. You know they can lobby in some areas, And you know they can lobby in a salon no to so. He said, don't talk. You know that talk the way to mean. Yes, Mr. Investor, you don't talk to some officials. What's in against her?
The Ministry of Health.
Okay, inside the Ministry of Health,
Different technicians there.
Okay, the different technicians them within inside the Ministry of Health,
We had a very profound discussion and understanding.
Okay, then get good discussion and they understand themselves. They understand. Yeah, understanding. Well, Sabi, understanding as alone. Then get good discussion, then they understand themselves,
About how to go about the project.
how for go about the project. The project and the investor where they can invest in a who's government? Diagnostic general purpose diagnostic center na Salone.
Now we are actually in the implementing phase because
then at the implementing the starting stage because of waiting, sir.
After that, we were able to find a place, a temporary site.
Okay, after that, then go find a place, a site for Bilame.
We're going to start providing the services already within 3 to 4 months. So,
okay. This investor, it gets first a temporary site where it go begin doing business, and now and then for take from now within 3 to 4 months. Now it go take. Now in this investor in go take within 3 to 4 months. Within 3 to 4 months, now it go take for provide. Just temporary. Yeah. Prince King himself don't carry with you. And for listen, yeah, I don't know how you come, but I hope say you go listen. You don't ever try for call and they not take you call. What you right say now only in your own people them. Now then they contribute to the program. Yeah. I be make disclaimer just now. I not be no say Prince King self get for Kaution. But anyway, forget you. Let's continue with Mr. Investor na Sierra Leone.
the place is already selected here in Freetown the last 2
According to
4 days.
Tijan C.
Okay, they don't select the place where they go build the temporary one, and also for make you get the general purpose diagnostic center na Freetown.
Them and the Minister of Health and Sanitation don't get agreement on plenty of the thing them where they inside this agreement.
Let's say, in principle, we agree in everything, okay? Now there are some details. Like I would say it's about maybe 15 to 20% of details that we need to work out. What?
So now 15 to 20% details at this initial stage, now they go need for workout. Eh?
Are these agreements for listeners?
As I told you before, the idea is just for them to accept this multidisciplinary center to be implemented here and to use the services for different parts of the country. And
so, in the camp for can open, and you want let the government agree say, not of it no more, but in go open and a different side them. Na the country. You hear,
also to tell us how they want to come about to support and help sustain the project.
How the government self go come for support? You see the other word we use? And for sustain. So not to say, na something we go and begin today, then tomorrow it done. He say how government go support and how government go help for sustain the business so that the business not go just die in 1 or 2 years. Sustainability. Investor. Sustainability.
What's the ballpark figure of this investment? I mean, the total amount.
Yeah, it's about 150 to 200 millions.
150 to 200 million euros. Now in this investment get for cost. 150 to 200 million euros. Now it go cost.
Million what?
Euro, yeah.
250 million euro investment.
Investment, yes.
What are the specifics?
The specific meanings, it is part is for construction. Part
Okay, that money there. One. And for construction,
is for equipment.
Equipment them, we go there now the different diagnostic center them.
and other part or for certain services to be put in place.
Certain services them for put in place.
Let's say the training of certain people
Training, okay.
that need to be trained on site, trained abroad. That's about. And also, as I told you the last time, it's not only in Freetown, it is also in the next biggest city of Sierra Leone.
So not of return no more. Not of return no more. But in Yaidepa, all the big cities them, na Salone.
So also construction will need to go about there, and few big equipments such as mobile units.
Then the plan again forget mobile units.
And ambulances should be here.
But waiting will be the
Ambulance back no they left behind. Then the plan forget them.
benefit of the over 1.5 million euro investment in the health sector. Dr. Austin Demby, the Minister of Health and Sanitation.
Let can listen Dr. Austin Demby now, yeah? Waiting in the explain.
When this center go complete, I mean, until say right now, in fact, then ready right after we sign the MOU for let them set up a temporary office over the next 4 months.
You know here now, eh? As they sign the MOU, understanding don't they between them and the Senegalese investor them. Senegalese investors then they like CSC. Most of the roads they within us alone are CSC, eh? Apart from the one way China in they do. A CSC. Okay? There they go.
And then they begin construction of the site, then get a time limit of about 18 months for get the facility in our Freetown, then get.
So about 18 months, 1 year, 6 months. Now in them plan for get the big one. But within 4 months, and they get one temporary one for let them begin work one thing. So money go begin kind inside one thing. Eh? Now investment. Now business. It's profit making. So don't forget that.
5 satellite sites throughout the country. I think this will be a very, very important addition to Sierra Leone healthcare. Because and right now.
So the minister say this go be that's true. To addition. But what will they add per se? We no one say na start to the start. He say to addition to which we don't get already. What did we have? Anyway, that's true.
Beaucoup people that we want CT scan, pass you go Ghana. In some cases, it's really difficult for get up. I know say we get CT scan capabilities now, so with some of the private sector institutions. But I think the more of the one and they will get available and spread out throughout the country, it will give people them better access. Right now, a lot of
so would they expect for get CT scan? Eh?
People then for basic diagnostics, pass and go Ghana, pass and go India for them. It will save all of the costs where people then they pay for go abroad for them kind of services. Yeah, if we get an salons.
So now for let we get them services here in a salon. So people them not go they fly out of salon. Say then they go seek then kind service there. Okay.
Dr. Austin Demby continue for talk about how far governments don't go with this agreement implementation.
Let we pay attention a big because I make a tell you say. That starts inside must be mistake small. Not to government own this so. These are the private money own. Because Dr. Austin Demby can't tell you about the government's own. Eh?
We done all of the initial studies and we don't get design work already for the cancer diagnostics and treatment center in Kerry Town.
You know here now? He said they don't get design something you know here you find. Wait. I want make you talk that part say back for we sir.
For talk about how far governments don't go with this agreement implementation.
We done all of the initial studies and we don't get design work.
Initial studies, one, Dr. Austin Demby say don't done. The one they ask for, the ultra modern. Two, he said they don't get the design. Eh? The design, the kind way how they want for designer, they don't do and done.
Already for the cancer diagnostics and treatment center in Kerry Town.
You don't hear, eh? It's different from this one, oh, not to the same. Okay?
So that bid they can open fairly soon.
That bid they for that one the government in own. He said the bid they can open fairly soon. why make you feel to say this investor they try for say he want the government commitment to his own sustainability? Unless if the government get for tell and say make do cancer diagnostic na your general purpose diagnostic center where they can build. Now making the talk say in the see how the government then get for sign the MOU. He said the government get for help am. Because you don't know say the government get plan for can make their own. So in own go be sustainable. But Dr. Austin Demby say soon then they can open bid for the government's own. Remember, from 2020, the president said $19.8 million. Then we don't approve and done a cabinet level. But now, we don't land say, through Dr. Austin Demby, say, well, they don't do the design done. They know who side they want put her. Now soon, they go come for the bid for other one for can take on the project. You remember that other one where they be go turn sword for na the same carry tongue? You know say that they no put, no pen, no go nowhere. We don't cover me. The people who then take the land there, where then go they say let them give them the land back because they know you say the people who become for can do that investment they don't turn back safe. But the government don't tell we zot nothing. Okay, let's continue.
So that in a direct government investment.
Then they own na direct government investment. This one they talk so na carry tongue. Where say the bid they can open for. A different from this one where Mr. Sheikh from Senegal they can for can invest in. And all get and confused.
At the same time, we know say the need very, very great. So we did look for other partners we go can join we in the service for salon. So
they need very great. Then they look for other partners for can join them. So Mr. Sheikh na join, he can't join them. Anyway, let's continue.
One name partners in a Senegalese group with themselves come and say they want for invest in just plain diagnostics, including.
Yeah. The government own na cancer. This one na plain general purpose. Just where you go, then diagnose you with na malaria, na CT scan you want do, na this scan you want do, na that scan, then go do one for you. Now I make us say, where the minister now they talk say, na just plain one. For let they no go fall out just no. We don't open them, instead one do cancer. Where the government don't get for do cancer. So for say the government should not go do the plain one. I not say we want competition. But I made the man they say he want the business for be sustainable. Oh. So I don't know assurance government get for gear. Anyway, let's continue.
Labs, including imaging, and at the same time, they want for support forensic science in this country.
So then go they do labs, including imaging, then they want support forensic science at the country. That is fine. All right.
The Saloon ambassador to Senegal, Alhaji Brahima Kourma, na the person will bring the investor for can invest na the diagnostic center. He talk about waiting the investor they expect from Saloon governments.
All what he want is partnership, which means
he say all waiting the investor want a partnership, which means waiting government thing go do.
Government is willing to provide the land.
So one government willing for give them land.
Government is willing, instead of giving their people outside for go treatment, if this center is established, government can now transfer those people here.
So where this center established, instead of government they send young people and for go out of Sierra Leone, government go they send in people them na this 1 year where they can open in 18 months. And they talk more. And wait till they tell the man. Because if the business thrive, more investors go Canada country. But if the man come, within 1 or 2 years, he die, other investors then go afraid for come. Now this time promise the man. Say, the one the way government king responsible for where then they send and go out of saloon. Then go the send her. Go to her. Where the government's opinion, what thing they go get for do? Now bidding process then go they do? Forget government attention? Or waiting? Let we go.
Of living to Ghana or Dakar. Secondly, they also look at other components like the mining sector.
So, una wan come, then they look at other components then. No. No. Una stay focused back. Una stay focused first. By this diagnostic center. Una can be divided. Una mind can they under. No, una not look at the mining. No. Me na so three police so. That's what me say. They not look at the mining yet. If they don't meet up, they don't sign MOU, let them focus first. Pa waiting. Pa the diagnostic center where they say that they can provide for we. Because this one way, the ambassador in work out and don't begin to say, then they look at other components like the mining. We're waiting again.
Other areas, those who are working, it's like just an insurance issue where even the government before now, they try for let them float in the country.
How una come to conclusion for pick this individual? Is it through bidding process or una just say or una just so sources say this person one can invest them with it?
No, you don't say we mission as ambassadors now for go out and look out for credible investors.
So he say ambassadors then can go out and look for credible investors them. They don't go find one.
When once you don't get a credible investor, you don't do thorough background check. You cannot come with time for presenting to the relevant authorities.
He say when you find investor, you do thorough background check. You can counter now to the relevant authorities. Say, brah, I don't go see investor. You want to invest by the diagnostic center. But this way they can't tell say you get your back by mining. No, let's stay focused first by the diagnostic first. Oh, si say he provide them, he do well, then no can go pa mining just no. Then si say kuku jumuku de anda boku, they make and they quick. They can't forget about the hospital business we say they can do. They can't go for them pa mining no more. Now show me the same.
That is what we have done.
The JANC and the government of Saloon hope say inside the next 4 months, they go set up medical center where go they provide treatment for Saloon people, and self hope say inside the next 18 months, they go complete the diagnostic center where they go build a Keriton and other parts them na Saloon. For the Society for Radio Democracy, Musa Kamara, the reports.
One for tell Musa Kamara thank you. For that reporting and Radio Democracy. Because now true they make me able for hear this. You see how start this talk, You see how don't reach with him? You say waiting? Exactly. Diagnostic center. Na Saloon. Na Keriton. That other I want to see who side and go give them people here. I took her for send the camera and the back. Who side and go give them people here? Who side and go give them? Because that other side the president be go turn short. I did tell you. The investor they don't back out. They don't mix again. I know they tell you out of joyful, say investor come and go. No, that's not what I'm saying. I'm informing you for say, Paolo the president be don't turn short. The investor they don't go. I will take no that the people them they land where they be take where they say them go give them some side. That's what take no. Now the same Kerry town, now they why I say then give them back. So now that same place society other one them become what? Well, if the president be don't turn short, they will they no work. He go turn short again, or he go just say no, I be don't turn short in advance. Let them just continue no more now. Sustainability. The investor, they ask how government go able making business sustainable. The ambassador wake out and say, by when manner, we they want them, we government king responsible for where they pay for them for go out. Then go they send them to Ram. But government get plan for Bill Leone. This man say na 18 months in the take. In the bill and done. 1 year, 6 months. In the bill and done. Sharp. He begin work. CT scan, all the kind of diagnostics them. Everything go did it for we. Alright. We do it again. I'm happy for that. I'm not saying I'm not glad. Yeah? I'm glad for that. But 2 years ago, now only now, Dr. Austin Dembi they tell you say, soon then go come bid for him. Then go come bid for him. Soon. Only now. After 2 years, we cabinet be don't approve. Okay. Oh, they wait. Even though people say, not for talk about that. I mean say, oh, they talk and so, and the other side we dey. It's okay. Before I can come for them program here, I can already don't put on me proof. So now they send and so, I just do me elbow and so, and me shoulder, all the shake like I the shake so, all thing they for them back. But one day, we all gonna say there is a reason why so many Sierra Leoneans in the come here for make we can discuss. That's the only power we have for make a change in Sierra Leone. For hold leaders accountable for things them wouldn't say we they not deliver. But if you see them, otherwise, I'm sorry. Whose friend, you get the platform, sir.
Yeah, thank you very much, AAA, for giving me the platform. And thanks a lot for the listeners who get here. Just again, one for welcome them and let them go understand, say, waiting would you do so, the government will not replicate them. And recently, they be Mona Solomon Jamiru and other lots of personnel, then call something about light and colors. But I go left that one day. But was they just bring out the need for the tell the truth to leaders. And guess who are doing it? Solomon Jamiru was in. Not the wrong thing they do. They expose exactly how they talk so. Since I didn't hear and they find out hard the truth to tell the press they make. And it was just, I don't know if now the beginning of this week or I think the tail end of last week. But not leave out maybe for the weekend. But this is something they are trying to aware say now in the need for the do. But only hope so then go take them. So there's nothing wrong you bringing things at the platform for let people then discuss and let them go take part and give their own contribution. So coming to the area of health, which is very serious about the area where we find we self, but not global problem about health every side, but it depends how we are able to manage them in the infrastructure what they put. But with developing country and Sierra Leone for that matter, we don't struggle quite a lot for long we build infrastructure. We don't get people that we know how to do the job most times. The capacity and the ratio, another the other problem we get. For say we not get people who sabi, we get people who sabi. But the ratio, when you talk of doctor ratio to patient, or no, the nurse ratio to patient, that na other area who then they try to develop. But coming out to the infrastructure where you be say, with the look say, let them sabi, who sick way they pay you, how they go able for address them. It diagnose for no sick way do it, and then they do the prognosis. Then usai now the person go use his sense, say, well, I determine say this sick here, not fit for like there, you get for go na so place for like go do am. If you not do an so thing they happen. Or you sometimes you get the means back now for do this, you go ahead for do am. Until go na Ecomed, go do this. Sometimes we go able for can put plaster of Paris or if our food broke, then no side day. But the point here is about how the health structure then they put them together based on funds they would on the come inside. Now a global fund, now pick up the global fund. Now donor funds they will be on the can of the country for try help. They all get agendas. They all man they get agenda like global funds so like you see now children, so like you say now women, all the areas and try for look into them. We don't see they boost and they push. We they see even individuals and now people that when are philanthropists and they go help like the recent cancer center where they open our 10 where they don't put that elevation when are just above the cost recovery for medicine day. So these are like get donors and people that philanthropists, people that try for push, when I say like I can go and give all these kind of things they go on. But here comes lies now the government where we don't see how the government, if you come, you they try for help. Okay, you know what says I no go help because the others will not be help. So you now come help. But if they say well the other one they not be help and the other one they will not be help because of this and this, they not sabi or they not do well. Me, I go make them that these are the key. So they pronounce it 19.8 million US dollar. I don't approve them for let them put up this tier because until I'm money not be there, would they not be one build this particular thing, would they help for let the health in sector will develop. Because once you get a good diagnostic center, where they able for check for all diseases them. Because when you talk about diagnostic center back, in a thing will involve quite a lot. We know now say you get all kind of things for check from you here and you take going at the top. All sectors where your body make up, that sector they need for they all for able to check. We say then doctor will come, he look no more, he ask you, you're not able to forget the findings that what you need. You go say, well, I'm not so sure. Last send you for go do this. Last send you for go do this test. So there comes now the availability of the diagnostic center there. So the talent is done the day. Global Fund don't they come inside, then don't they help? You they get UNICEF, you they get all these things, but you they ask the questions all the sequence, apart from the structures and where they see Global Fund they build, like they don't build the size of the stool of nursing with the next to the connotes by that mortuary end, they don't do something development inside or like during. You see partners in health with some other Chinese and other few people, they don't bring down neonatal, they then picking a wound, and then there's going to school, because young baby, they wouldn't be premature, they bring all those kind of things. So, but the question can big on the size, the quality, and the lasting, the consumables that are waiting and used daily. Because when you get the structure, then I want you get the people that we get for come inside for do the job and a challenge. Then the consumables and then how you go maintain the infrastructure we contain now technical machine them and other machine them for work with, we maintain. That's the challenge we can see working deep and medical. But coming down to this area where this government don't pronounce the own one where they say they will do ultra modern diagnostic center. Based on the one way they be decision and they put the amount. And then they see now another marketing. Because this is a kind of a marketing, now in the kind as a private sector, a marketing of a diagnostic center. The man they try for market in diagnostic center, now areas the way Bill say, will begin see instead will begin the push go before. So the marketing, one of the private one, that is good depending how you structure your policy and how you structure your system where you get regarding health policy, the way you don't say, you don't actually put health sector strategic plans. Those strategic plans we don't put. But the strategic plans, they get for cover the patient, they get for cover the one who they deliver the job, they get for cover the health the health facility that way they put up to the consumable, like the medicine, the way they say, okay, would they put tax per anything they have for inside, or would they try for make we own, or would they try for get things when are up to date, when are the right quality, or not to fake drug, or not to fake medicine, or for something when are cosmetic. It's actually a broad thing, but approaching it from the part where then don't come, say they will come build this medical center, when are the so much ultra modern, and then they see that the pole they shift some other area now where somebody can do a marketing, but the marketing is just like the EcoMed. Now at the point where in the bring car inside or the sector where you want for bring size of infrastructure, say now like EcoMed, because that for just diagnose, then we're able to find out to seek. The question lies: Is he gonna be treating, or is just gonna be diagnosing, and then people then would refer them back to Europe or to send them to Ghana? So this is the area now where they say when you do a marketing and when you draw things inside, you try to avoid duplication. And when you avoid duplication, so that the development become especially in health sector an ongoing thing. Because here this is like a duplication where they happen and a competition with few other radiology or them magnetic resonance, MRI, they all sort of diagnostic sector them where they don't dig in now. Well, then they do their own business. You said they can't get them for do your business. Then the government now they fight for let them get their own place in the system. When you look at Senegal, what in them do? Because now from there in they come out really. What in them do where then the profits now for even give some help outside? Because there was a thing where COVAX been put on at the World Health Organization with some other bodies they wouldn't call way, then they do like sponsor for you now you they give this particular infrastructure, you now you they give this technology, you now you they give this. So what's this? The all man they not like when they say no more, all man they contribute for them make a party, you were able to make cake, you were able to make this. So that was the portal way World Health been do. So they'll be able to tap from there, where I can always be the tell them they tap from there. So now they don't get them for make them in medicine they wouldn't be they do. And then also then beyond they get a help from this other find and unit aid for letting can make then they make that test would be that rapid test for antigen test. And then from there now, then they try for introduce how they go try for they make some drugs, they pass out the patent law. Remember, we don't pronounce in a parliament by Tunis. We be seen that now one of the plan where ECOWAS gets. But I don't know from then what he pronounce them when he go bring this, wherein then be mention and back say that one when I carry on we be see them go put some Libanese where they say don't withdraw. Then be not tell reason they begin to make medicine then they. But when you do all these things, you get for link with the right people them, now they get international relationship, international trade, and then you get the health sector. So these are always the challenges that way sometimes they can leave out, they see development go one come, and then development go one for push, but sometimes the route where then they go, they help with. Because if that route where the man they can go, it go there on the own. But you get forget customers, you get forget begin to get things in our way, it's like competition. We don't know how much of in technician the way you get for bring then go their amount. Or now from we on there you get for the tech use, who don't know how much strength we get of the qualified one they eat. So this that question we don't know when you get for do all these things. But I believe say go bring expertise with them. But I go again with the trust say go get people that want for shadow this expertise in a salon. It is a help again for land people and for landscape. But you look at the landscape of the business pattern where they work. So you can't bring somebody in the end. You will reach a point, then you will begin to say, oh, I not get dollar, or I not get this, or I not get this, or something happen, or light not there, or other factors in there, or competition begin to flop between, or you they come with this system. So all these things that in the get for look into. So as I say, Senegal don't do their own. They don't develop their own. Because their own, they get the one who are the Bio 2024. The Bio 24 Diagnostic Center. Now in the MB. Now they didn't get, and they extend that not only a diagnostic center, they get the treatment center. So all those kind of things I get for look at now, not only a diagnostic center, but a treatment center. But now in they say, now ultra modern. The ultra modern what them before, then the government for don't do, now in they contain the area where they would see them they treat person. But now they don't narrow them back to cancer. So if they narrow back to cancer, we won't deny because people are only cry for that one day. But it all comes down to an area where they talk say how people are able to evaluate what we get and based on what we pursue and what we want for invest for. Because the detailed part of it now, I don't want to go too much, but the point here is at the moment we get a problem wherein the aid where we for don't they get regarding the medicine that will be done, they get with a free health care. because the UK been dey give we some percentage towards that money dey. Now they don't cut for reduce am, and you get Germany again. Then they plan for cut the aid when at the medical aid to particular countries, or the fund where they go to other aids, because they see they try for build their own defense, they try for build other things because of this issue wey happen in that east and part of that Ukraine. So when you see the trends of these funds will be the come, the global fund, they focus on something. Then you see say the funds that will be don't come, like funds that they come, what they say we get from World Health, other funds that we come. You go look, say now, yes, now they think they are all there at the table. Make us see if I will able to share some of this money back. Share them, put some of the money for one thing. They tell the people, they turn around, look, this. Now, people that understand I am local, I am the base, I know the terrain, so that I go able to develop. So when you see all these kind of things, you as a leader, you need up to things there. When some of the aids they come, you will miss the purpose of the aid, and then you go end up for beginning to ask these private people for kind side. And when the private people are kind side, remember they are aiming to maximize profits. Except if you get a plan of strategy or rights that we will do, will for label help get a business from there. But I will left out for now, and I only hope say then go able for look into waiting and go try to do for we actual health center when I the one we go able for get a lot of diagnostic facility so that then go able for push go before. Thank you very much for giving me the platform, and let God continue to help we and help the nation. Thank you, sir.
Thank you very much, us friend.
Yeah, welcome,
Yeah.
sir.
Okay, that's now us friend in your submission for today. Make we come with the doctor, make we waiting he gets for we. Welcome on board, Dr. Isatuka Kejalo. You get the platform.
Yes, hi, good evening, everyone, and I hope say we all do well. Good morning to many others. Thanks to you, thanks to us friend, as well as to the listeners and the viewers we they listen to we now and we get for listen afterwards. And to the people we get intention for come invest na Sierra Leone, 98.1 as well for them reporting, and the Ministry of Health, as well as the other individuals, and we give some highlights, as well as to the president. We don't listen to his speech we give, and we you don't show a comparison of the initial speech we come about in 2020 as to what Saudi right now 2022 for 2 years, where we not able to foresee yet the statement we will be hearing from the president for say we will get a diagnostic ultra modern diagnostic center in Sierra Leone from the funds them we then don't generate from corruption. Unfortunately, that not take place yet. I think say we don't ask that question multiple times as to waiting they go on. If that money they available, why that 23 billion loans still not able for invest outside the president we don't promise say we will get that. And sometimes like I always say, it's good if you get the intention, but if you don't say the means or the way no day for do am, make no sense for come and make the public know, because then waiting you go don't do, as a leader, you don't make the people them na Sierra Leone the don't feel say what we can't get something because what the president don't promise we, and in within speech the way how it sounded is seems like it will happen within the next couple of months to a year, but that not happen. And we all they see the issues them where we they face now the country we can to healthcare. We they see how many picking them where they sick, where they need, or even adults them, but we they see mainly sick picking them with multiple tumors them we need a diagnostic center in the country. And sometimes the money where we they spend for take them people that are out of the country, some of the cases them where we don't see it on they happen where government get for help, and also individuals and get for donate for make sure say this happen. It costs money, and not to wait for help your country for let it grow. Rather, it help the country for let go backward because the money they left the country and go into another country, where it be say, we know they say, yes, sometimes you don't need to seek healthcare in another country, but why not improve we own our country so that people can go benefit, so that if the money where they spend now for one individual or two person, that money they, if you spend on the country, most likely you go spend on for more than 5-6 people them with the same amount. So that's not something where I feel say healthcare is very important in how we go improve the economy, how we improve the life expectancy for individuals them in the country. As the presidents, they talk about the improved rate of vaccination. Yes, that's not something where we want for see. Anything we get for prevent an illness, it's better for let you do a preventative healthcare than you do a treatment or than you do a rehabilitation where you can to healthcare, the primary, the secondary, and tertiary healthcare system. So we focus more on primary prevention as well as, if there is a diagnosis, then we try for make sure see that diagnosis day we caught them very early by early screening for mammography, early screening for prostate cancer, early screening for colonoscopy, all that thing there. So how we go able for get them, how we able for access them. I think we were only able for access them if we get the system and the healthcare system, na the country where they provide then different services there. So for bring awareness to the general public, say, at certain age you require for do certain medical checkup, because if we can find out, say, you get a polyp within your stomach, for at the age of 45, when not the actual age now for screening, for colon cancer, if you can screen that early, or somebody where it be say you get a family history of breast cancer, get screened early enough, you can find out about this cancer and able for deal with them at an early stage than where the stage don't advance. And then there are certain stage them where you don't advance, you cannot do much. All you can do now palliative care now you provide to the patient. So media take and say, and the president as well as other administrations them we get for come on board for really help with the country where it can to investing in healthcare now the country for focus on the waiting at the benefit if we get an improved healthcare system now the country. As we talk about healthcare delivery system, there are multiple things and the way we for focus on. You get for focus on integration, the patient-centered care, meaning you want to involve the patient within the care of when they get, meaning you get them going out, there'll be mobile centers that you can do screening, for breast cancer, for HIV/AIDS, as he mentioned, say the rates don't go up. If the rate don't go up, within are some of the community teachings them will they provide now the different communities them on a different health center for make people that know say, you can come, you get tested for them kind diseases there, and it's confidential and it's safe for make you do them for let you know, say, what, either you get HIV or you get hepatitis, you get all these different, sexually transmitted infections. Knowing that definitely at an early stage, the help for let the person get treated and also for let the person, in life go long, go able for live longer. Right, so cancer gets stages up to stage 4. Stage 4 now a metastatic disease where it be say now the cancer it don't left one organ, it don't transfer to another, and in those cases we can't do much. But we find out about a breast cancer, for example, at a stage 0 or a stage a stage 1, 2 up to 3, you have greater chance for curative, and these are the time where they give chemotherapy or they give immunotherapy and say these are curative intent. So definitely the healthcare delivery system need for be a hub where we say there is that medical home system, like the elderly people. You want to make sure say they know how to access emergency room centers, acute care, and then the intensive care. These are things that we need in our communities, in our country, and also saying that there will be a competition with the investor as well as the government. And I see there is a need for that. Waiting me believing like multiple healthcare centers them across the country now a way for benefit the people that are the country. In order for let somebody do anything, let you work, let you get money, let you do anything, you have to have good health. If you healthy, you go before do anything there. Sometimes we know they find out about diagnosis them for patients that because either then they afraid say they not get money for going at the healthcare. So government in your institution for be there available for provide services to people that we not get higher funds for pay for their healthcare. So that now one thing government get for look at. We where they work now like a city hospital or government agency institution. The people then we can come and take care within we own institution and compared to the one that we're gonna a private, not to the same. Either one, even though maybe in many cases we can provide, above and beyond, for this individual, but we need to look at the patient in financial status. We need to look at anything. We look at the fact that, say, what, these are some social, problems them with and they go through, and the government or the healthcare providers get for do them best for make sure say they care for the individuals. But in Africa, we know say if you don't put money in front of a patient where it kind of hospital, they're not can treat them. We don't get so many cases, then so many complaints them like that. And we see again where the burn victims them, many of them lost their life because we not get a burn center, a place where then they take care of burn victims them, because there's so many different things them you get for do within 24 to 48 hours. You get the emergent phase, you get the acute phase, and then you get the rehabilitation phase. These are areas that the governments get for looking to see if somebody want for invest, look at the centers them or the areas them where we not get now we country and try for make them understand say we want to invest in this sector and we also they in need of something. So now they make that memorandum of understanding, then go understand say we are in need of this. So bringing this in our country is a way for you to invest as well as generate income. Focus on that, and we self now the country or the government can able for now focus on the areas then where we lack as a continuity of care, right? With that again, the president in speech mentioned about ways in how we can improve the healthcare system or the healthcare delivery system through health, information or through technology. Yes, these are things we're very vital in healthcare, because currently healthcare and technology they go hand in hand. You talk about a patient having a mobile app, how they go able for reach out to them healthcare provider, check their labs, check, make an appointment, request for prescription or refill, as well as telehealth, telemedicine, where we can do, video call or, a telephone visit over the phone or in a visual call with the patient for make sure, say, you can provide care to them, virtually, right? We don't deal with that during this pandemic, and that's something we don't go on for years, but, during this pandemic, it was utilized more than you can ever expect it to be. Definitely connecting, it help for connect patients them with them own provider. These are good vision and they are good things. If we're able to put them in place, definitely we country can improve. But again, it's just sometimes as we hear anything there about investment, it make we feel say okay, there's hope, there's still hope alive. But then where happen after a couple of months, then it's like it's all again back to square one. And I think that there we can get issue, with the current administration coming in and talking to us about things that are in place or things that are people don't mention, say they want to invest, and then happen. It's so disappointing. Then we talk about as the president, they talk about say them we don't hire so many or they don't. If they plan for hire up to a certain amount, and now they don't hire so many healthcare providers. My question is in that light for make sure say we get improved healthcare so that patients they're not going to die or patients they're not going to be neglected. Now the healthcare institution, especially the government hospitals, then at the country, what's in the patient care ratio, meaning how many patients to one nurse, or how many patients to a physician or to a practitioner where they take care of a patient, and how many laboratory texts that you get where say maybe this patient will come to me, I need a stat, meaning when you say stat, a test where you run within 15 minutes for make sure say you able to diagnose this person and treat them. So as I always talk, and always in healthcare we focus on that prompt recognition and early diagnosis as well as early treatment. It is save patient in life, and that's why that patient care ratio and making sure the healthcare providers them or nurses them gets the support where they need, and then they not go get staff burnout, because if you get so many patients then you tend to find yourself so burnout because you're not able to take time for yourself. So there should be is in this same system, in this same healthcare delivery system, the insurance for the healthcare providers them to the patients them is very important as we talk about healthcare delivery system in the country. So as we want for talker in writing for let the people that know say yes, these are the things and way we want for put in place. I think for make sure say it happens, right? And then if we get a better patient care ratio, we will get better patient outcome in everything where we do where it comes to healthcare. And then we talk about the investors them wanting to start this whole project, first getting a temporary site for make sure say the care start within 3 to 4 months, and then with the hope that everything will conclude or the structure will be up within 18 months. It's a good thought, it's a good feeling, and you want for hearing something like that where it comes to healthcare in the country. And that now way we also say, what, it's good. Maybe there are individuals and we're willing for go and really help for let them go train nurses them, or some veteran nurses them can willing for give them service for make sure say then teach other nurses, then teach other healthcare providers or physicians them also go be there for support, the government support the country for make sure say we get trained nurses, physicians as well as pharmacists and other healthcare personnel, with that ongoing teaching, because sometimes people need to understand there has to be a continuity of care as well as continuing education, because every day healthcare they change, every day technology they change things, and they change as they grow, as we generation they change. Then the other thing about this whole diagnostic imaging, why it's important, why we need another country, we really need them in the country, because for let you diagnose cancer, certain cancers them, they only diagnose these by a physical assessment or a blood test. You have to do a CAT scan. Sometimes people say, oh, we do x-ray. Not to x-ray you need for diagnose cancer. You need a CAT scan or PET scan, sometimes with or without contrast. Most of the time it's with contrast, depending on what's going on with that particular individuals. And even sometimes when they talk about, doing an echocardiogram, depending on what type of treatment this patient they get for in cancer care, right? Some cancer cares, then there's some cancer medications, and they affect your heart. So you need for they do an echo every 3 months, where it be said that they tell we within at the ejection fraction, how well you pump the contract and pump blood out there. So if we give you this chemotherapy, how much chemo you can get now your lifetime. So that's not an important stage or aspect in the care we come to the diagnostic side of it. And also we talk about people that we can get pulmonary embolism. They just do a regular CT, you have to do a CT angiogram. So it's very important if we get multiple of those things now we country. And if we do so, even them picking that we can born with 10 tumors there, so we can able for diagnose them before we wait for a longer period of time, And as I only say, competition in healthcare, I think we can see that here in the United States. You see where people then they say, I'm gonna go to Memorial Sloan Kettering, now the best cancer center in New York, or among when at the second best cancer treatment center in the United States. You go see where people then they talk about the Ghana your institution and tell you, say, I want a second opinion. Because why? They don't give me this treatment, or they don't give me this option, but I feel say I will get something better. So that competition they in healthcare, not a way for innovate, not a way for create ways them how we can improve the healthcare system in the country and also around the globe. And that's not something we all healthcare providers or institutions and the fight for make sure say they are the best among all the other healthcare systems. So I don't feel say na something where them for look at, but government for no say denga for do their own part for make sure say the communities them get access to healthcare, and as well as if there's need for advanced treatment, then get side them we then would transfer them. So I think for me, in as much as some of the words or the things that came to us today is very important, I think we just want for make we bring awareness so we communities them or make people that know say then get for the always take care of themselves, as well as like government spend money USA in need for spend them, and USA government need for spend money. Healthcare are one of them, and we really the hope see then take this very seriously. If the money they for the diagnostic center or the ultra modern diagnostic center, I think it makes sense for like government spend that money in that area, so that way we can really improve things as Sierra Leone. And we self go feel say, what, we can't really try in some light, not to all the time then think how would they raise with a voice about it, because it's really frustrating sometimes when you talk about it. But we feel say now we responsibility, now we civic duty for make sure say we continue for advocate for things and we go better with country tomorrow. Thank you.
Thank you very much, Doctor.
You're welcome.
We want to say thanks to Dr. Isatuka Kejalo and also Usfen Kamara for their own contribution. The phone line is now open. If you want for call, looking at the screen, you go see the numbers them for call. 232-78990-991, that's now WhatsApp. Or you can call 1-646-610-3107 United States, or 44739-803-0402 na United Kingdom. At the green section on your screen, you go see the numbers, then they scroll. And if you feel say we don't do well in the next 5 minutes, we go left here and ready for which you can lay back na table tomorrow. Tell us, he said the initial speech where the president being give after they began that 750 million leons from ACC. The president being say then go build a state-of-the-art diagnostic center. He said now later by another speech, now he change them to ultra-modern diagnostic center. Okay, all right. Okay, all right. Saturday I get something then for playing here. Yeah, I know say we say sometimes, oh, AAA left them people. I know sometimes we need to educate them back. The person say, me, the money where I be say the bridge cost, and the Prince King, I think. He say the money when me say the bridge cost, nobody not talk him. Alright. I go play with the person they talk how much it cost. Saturday, not today. Naya. Okay. Even come and ask, he said, what to Tripoli? If government change, you don't think so? Then go do tit for tat? I don't think so. I made the investor they try for get some lockdown business. I tell her they ask, what to the hospital waiting and go to use a generator. Some people answer say, no, they're not going to use generator. Then go use solar. Solar then go use. Okay. What do you go use solar? Think we don't try. Fambul them say we are good. I be asked the question and Dr. Austin Demby don't answer. So now just see question. Anyway, Dr. Demby don't answer. You see, they don't get the plan how they want for do everything. Soon, they go begin bid for them. Saldin they ask how the internet get for be. Okay. Correct internet dey salon o. Correct one day salon. But not to now for the one that will connect to the power grid. Internet dey salon we correct, yeah? I'll let you know that day. But not for the masses. But even Kajutel gets good internet. It's just that they just starting, so they're not all across the country. That's why. You want to know they across the country now? Well, I left so. Diagnostic Center, ultra modern. Diagnostic Center. We're still waiting. We want them. The more the merrier. Eh? Well, no need for council, don't hurry with so. So forget that thing there for go on that. So I didn't say Salo Internet Dick. Tell me about it, brother. Eh? Salo Internet. Tell me talk about an small yesterday. He passed a dick safe. Who they left ya? Ibrahim they ask, but they are now be 6 million. When Ministry of Health and Sanitation say then give WHO. Now be WHO or now be UNICEF. For go bye. You should don't forget self for that and give the money. 30 days they not come market it. I doubt if Dr. Uri remember that one day safe again. Because now be did it. I don't know if he handing over notes, he not be tell Dr. Austin, then be say, be don't send people and for go market. I don't anything say, well, now we go market too, but we know come again. Dave Katie, na carry tongue. I want to believe. But the investors then get plan for all the headquarter towns them. For building. Exactly, na UNICEF. And UNICEF then be give that money there. We get for ask Dr. Uri for that money there. I be give that money there. I be tell we. So don't forget. Una only forget first. I mean they not like we. And so they remember 2 months. Also. Hey. Okay. Let's see na ya. Oh, left here. We'll go there back tomorrow. Usman say, here you say, then bring back some of the item. But the value in doubt. We'll go try for ask. He just say the money lost, so then they forget for Kana house. Okay. We'll go there back tomorrow. Till we meet again. Triple say, tata.